All right. Hey, I am Jeremy Seacrest, and I'm the Director of Marketing here at the Evansville Christian Life Center. And I am with Gina Gibson and Kellie.
Hi.
And Jennifer.
Hello.
And we are at the Evansville Christian Health Clinic, deep in the conference room, hidden away here so we can talk. And so I'm just going to ask first Kellie and Jennifer to introduce themselves and talk a little bit about what they do here at the health clinic.
Okay. Hi, I'm Kellie Jarbo. I'm the family nurse practitioner here at the health clinic. And what I do is we run a family practice here that we can see everybody across the entire lifespan, from newborns all the way into elderly and everybody in between.
My name is Jennifer Harrell, and I am the Medical Care Services Manager. I just manage the day-to-day operations here.
Awesome. So since we're at the health clinic, we're going to talk about healthcare. And the health clinic is one of the services of the Evansville Christian Life Center. And it's our goal as the Life Center to help people move forward from a place of need. And that need can mean a lot of different things. And help them move forward toward their potential in Christ. And so it's not always really clear or obvious to some of us. I know it wasn't to myself at first, how the role healthcare plays in this larger picture of poverty and moving toward your potential. So, Gina, could you talk just like what in the world does healthcare have to do with poverty, and how does the health clinic connect to the larger picture of the Life Center?
Well, first and foremost, insurance is something that a lot of people don't have. And so when someone does not have insurance and they need to receive medical care, they don't know where to go sometimes. They don't know where to get it, or if they have to get it without insurance, that's how they end up in poverty sometimes, because of the cost that medical care comes to each person. And so we, with the clinic, have created this entity that we can literally help those who are moving forward no matter where they're at on that journey. It could be in the beginning of poverty, or it could be deep in the throes of generational poverty, and that's what we're here for. So whether it's someone who has insurance or doesn't have insurance, the uninsured or the underinsured is who we supply medical care to. And pieces of that, myself included, I can come here to the healthcare clinic. You go to urgent cares and things like that with illnesses, with strep throat and flus, and you can do the same thing here, because when we do accept your copay and your insurance, that helps pay it forward to the next person who may not have insurance.
Awesome. So Jennifer, talk to us just like big picture about the health clinic, what we do, and just generally the services that are offered.
Excuse me, we have a medical side now that we have Kellie on board, and what we are seeing a lot in the community is if you don't have insurance but you are trying to get out of poverty and you have a job and you get sick, what are you going to do? Well, you're going to call in sick to work, but you are going to take that time off, not get paid, but I can't go to the doctor. And so we just feel the need that we need to step up and say, you can come here. Yes, you're going to need to take that time off because you're contagious or so forth, but you can come here and let's go ahead and get you seen. And so we can see you with or without insurance. And then we'll talk a little bit later about the financial side of it. So we have that aspect of it. But another part we have is we have the pregnancy side here. We have a pregnancy resource center where we have free pregnancy tests, free pregnancy vitamins, and free ultrasounds. We also have a free STD clinic that we do on Thursdays and Fridays here at the clinic, and we are able to give medication out for that at a cost. And then we also have a dental side. We have a dentist that volunteers who does exams for us. We have a dental hygienist who's on staff who does cleanings for us. And then once a month we do a dental blitz where we extract teeth.
Cool.
Oh, yeah.
Awesome. So part of what we're talking about today too is that we are accepting primary care patients. And so Kellie, say I or my wife or whoever comes in as a patient for the first time. Can you just walk us through what that looks like?
Sure. So when you first come in to establish as a patient, we have an information packet that you would fill out. It would list as you would for other providers as well. It would list if you have prescribed medications that we want to be aware of, so we can keep track of what you might need refills on. We would want to know prior diagnoses. And then the first appointment, I really like to sit down, and part of that appointment includes me getting to know you and you getting to know me, so that we start that relationship. And I'll ask lots of questions, just to kind of get a feel for where you're coming from, what your needs are, and where we can help as a clinic. And if I can find other resources for you that would benefit in other areas, we can start there. And it kind of, we look at the whole you. We look at your mind, body, and soul, basically. So if there's something that you're in need of that is aside from a prescription for a medication, we try to help with that, or at least point you in the right direction for that.
Okay.
And it makes it really great because I have the availability here to really get to know my patients on a more personal level, and that really helps.
That's awesome.
Yeah.
So, obviously, the question that always comes up when anybody talks about medical care is how much is it going to cost? So Jennifer, could you, because we have a unique system of payment here, can you talk just what does finances look like?
Yeah, we have, if you don't have insurance, and even if you have insurance and you have a huge down or copay or deductible, what we do is we have a sliding scale fee. And it really is the state of Indiana that sets that bar for us of what we have to charge. And your copay could be anywhere between $5 and $35. But what we tell our patients when they come in is never not go to your appointment because you don't have that $5. Your medical needs to come before you're going to pay us that $5. So we have the ability to look at you and say, okay, can you pay $2? Can you pay $2.50? And then let's work out a payment plan. If you're just so strapped because you were going to be out of work for a couple of days, when you're going to get healthy, then what we're going to do is you can go to the Life Center and you can volunteer. And that would be your copay for that $5. Since we're a family practice, we're having families come in. We have families that have 5 children, and then you have $5 across the board, and then somebody's going to need medication. And we all know we have kids, if one gets sick, the other ones are going to get sick, and then it's like a vicious cycle. Come in here, bring all 5 of your kids in here at the same time. So let's look at this as a picture. And like Kellie has an hour with every patient, so she has the ability to sit down and say, where are you at financially? Okay, here's your sliding scale fee. This is what it's going to be. But what do we need to help you so these kids can get in a better spot so you can get yourself back to work? And that's really the main goal because, and we'll talk about this a little bit later too, I get off on the sidetrack, but with the GAIN initiative, the whole point is we're here to help you get out of poverty. We're here to help you. Kellie's here to help you. Okay, we're going to make you feel better. We're going to help you with your strep throat, with your flu, or whatever it is, the issue that you've got going on. But that's just a piece of it, a part of it. Now, if you have insurance, yes, we will bill your insurance, and we will go that route as you would go if you would to any other provider in the area.
Okay. So explain a little bit, like, who would be a good fit for the health clinic? Because, I mean, I know the answer because we talked about it beforehand, but when I hear you say, okay, this is for helping someone move out of poverty, say I'm not in poverty, I'm doing okay, I might be on the edge. If something bad happened, that wouldn't be good. I might be in bad shape. Or maybe I'm more stable financially. Am I taking a spot from someone by participating here? I don't want to take advantage of the system, but also if there's a way I can help out, I'm interested.
Right.
Can you talk about that?
And absolutely not, you're not taking a spot. You're never taking a spot from somebody. In the area that we're at, we're seeing a lot of non-insured patients. Yes, we are, but we are seeing a turnover of a lot who we have the ability now to help you sign up to Healthy Indiana. So let's get you on that first step, and then we have partners in the community that will walk them through the next step so they can get the insurance that they need. The people that want to come here, and what makes us different than everybody else is we have that Jesus aspect of it. Mm-hmm. When you're walking in the door, you're not a number, you're a person. From the moment you walk in and they say hello to you at the front desk. Mm-hmm. So it's just that personal touch. So anybody and everybody is welcome here. It doesn't matter where you're at on the financial scale. It doesn't matter if we're living paycheck to paycheck, which a majority of us are, or it doesn't matter if I don't have anything and I didn't have any food to eat. Usually, you know, Kelly would say to them, well, you know what, you can go to a couple blocks down the road and get a lunch at the Life Center. And that's what she has an hour with every patient. It's just for a family.
Yeah.
And if that's what you're looking for, if you're looking for somebody to connect, somebody to take the time to listen to you, then you belong here. This is a place that you need to come.
Cool.
Yeah.
That's good. Kelly, so Jennifer talked big picture about some services. Can you just go a little bit more in detail about what are some specific services that I could receive here?
Sure. So specific services on the medical side of things, I have a nursing staff that we are able to draw many labs that are here on site. So, you know, if after meeting with me and I say, we determined that, okay, we need to check your cholesterol, we need to check your blood, we can do that here and send it out and get the results back here, but you don't have to go to a separate lab to get that done. So there's many different lab services that we can offer here on site, which is great. We also, there are certain procedures that can be done here in the office. So we have the staff available to do a lot of things. There are things still to come, but
Sure.
these are where we start in establishing care with a provider, because again, I want to be able to get square one and then build from there as far as, okay, now we need to go here and we need to go there. So we can do a lot of that here.
Okay.
Yeah.
So we do medical services, we also do dental and pregnancy services.
Right.
Can you talk a little bit about specific things offered in those areas?
On the pregnancy services, we do offer the prenatal vitamins once they're determined to be pregnant, and then we would of course set them up for the ultrasound, which would also take place here in our office.
Yeah.
The dental side, we hold the when it's available, almost the monthly dental blitz. So I come to that and I help with meeting all of the patients as they come through, and I check their blood pressures to make sure that they are in a stable position to receive any kind of extractions. And if it's a dangerous level, we want to know about it ahead of time, because again, we care about how you're doing and we don't want to do something that's going to harm them. So we do that, and then the dentists can also offer as they see fit as far as any other medications such as antibiotics or pain medication. Mostly ibuprofen, I believe, is what they offer. And then on the STD clinics that we have on Thursdays and Fridays, we do have, for those tests that we run, if a patient ends up being needed to be treated, we do have some of those medications here on site that we prescribe at a cost. So.
Okay. Cool. Jennifer, so I mean, we've talked about a lot of services. So we're assuming we have a staff of 50. No, we don't. We have a lot of partners, whether volunteer or corporate. Can you talk about some of the partners we have and what they do within these services?
Yeah, and I'm assuming you're talking like St. Vincent with the...
Yeah.
Okay,
yeah.
okay. Yes, and we are always looking for anybody or another organization to partner with us, because a lot of, like I said, of our patients are underinsured or uninsured. But we have a partnership with St. Vincent and with Deaconess with they had for free mammograms for their yearly checkup. We have partnerships with Deaconess, obviously with the labs for them to do here, and they will come pick them up for us. We have a partnership with a few doctors in the area that do come and they volunteer here when Kelly's off, or when we're just we just need some, because she's a nurse practitioner and she is new, so she has some questions, and they're always willing and loving to walk through new things that pop up. And that is one of the great things, because when you have like a Deaconess, you have that built behind you. But the thing is, here we have Deaconess and St. Vincent backing us and believing in what we're doing, that will walk us through. That we're looking for partners to walk through with us when we have specifics. If somebody has cancer, somebody who has diabetes, for those when we need to send somebody for a specialist for pain management and so forth. We are looking for more specialists to walk through that with us, for us to be able to send those underinsured and uninsured patients to send to them.
Cool. Yeah. Okay. And USI and UE play a role in the clinics?
Yeah, they do. USI and Ivy Tech and U of E.
Okay.
All three of them do. They send their students over and they do observe through the STD clinic, and now they are coming over to work with Kellie
Yep.
throughout the week. Kellie is here Monday through Friday, and she's here we're open from 9 to 4:30. So there's always a student here somewhere.
Yep.
In the building.
Awesome.
Yeah.
And who is the medical director of our clinic?
Oh.
So we have partnerships with Deaconess St. Vincent, but we are under.
Yes, Scott Uloff, Dr. Uloff. Sorry, I should probably put Dr.
Yes.
Uloff. Yeah, Dr. Uloff is over Kellie and is our medical director, and he is amazing. Yes,
Yes.
yeah.
Absolutely.
Okay, so someone's watching this, listening. They're like, I'm interested in learning more. I might want to be a patient. Not ready to commit. Don't give me a big sales pitch. What's their next step, Jen?
I would love for them. Well, you can go onto the Evansville Christian Life Center website and then apply on that. But I always say, come spend a day with us. Come in. We'll give you a volunteer application. But before you turn in that application, I just want you to spend a day with us. It's not an easy job. I'm going to be honest. Some of the patients that walk through the door when we deal with the pregnancy side of them, we're going to see some young girls who are just struggling with things in their life, who need somebody to love them and show them Jesus, to pray with them, and to walk these next steps with them. And the same with Kellie. Some people, they just have had a hard life, and they need somebody to talk to. So that's why I always say, come spend a day. And it's okay for somebody to say, I'm not okay, but what I am okay with is working the front desk. What I am okay with is filing. Absolutely. And thank you so much for being honest and telling me that is not where I'm ready to start out at. So we need volunteers from all aspects. We need volunteers from the medical, who have medical experience. Obviously, we have nurses and doctors, but just somebody who has the love of Jesus and the love of people, who are ready to help these people take the next step to get out of poverty. To walk in the door and to walk through this journey with us. Because like I said, if we don't have each other, because like we're a small staff, because Kellie and I are the only full-time, and then we have 5 other part-time people. If we don't have that camaraderie as of a family, we're not going to be able to make it. So come spend the day with us, let us love on you, see what we're about, and then we'll take the next steps for you to be able to volunteer.
Cool. On the flip side, if I want to be a patient, what are my next steps? Or at least I'm interested in becoming a patient.
Being a patient. Again, come pick up a new patient packet.
Okay.
Would be great. Bring it home, fill it out. If you are uninsured, then we would ask, there's some financial information that we need to get from you so that Jennifer can establish the sliding scale. And also I look at that and see, what we've got going on, what we're going to be addressing, bring that back in for us. Or if you don't have the ability to come in and get that, call us and we can mail a packet out to you. Do the same thing. It would work either way.
And could I fill out the form online to do that too? To contact you to get it, to mail it to me?
You have the ability to email, and those go to me.
Okay.
And then I can email you back a packet, yes.
Okay.
Yes.
Awesome. So close us out here, Gina, because this is your role. If I've watched this and I want to donate financially, how do I do that?
Absolutely, because all of this that's being provided as a service in our community obviously comes at a cost. And so we would love to have financial partners, people just coming alongside, whether it is a monthly gift, a one-time gift, whatever that gift is. You can go online, donate online. You can mail it to the Evansville Christian Life Center at 509 South Kentucky Avenue, or you can call us and talk more about it. But more importantly, I would love to invite you to come on a tour of the Life Center, a tour of the clinic, to understand everything that we're doing to fight poverty. When one person receives medical care, just like we have the ability, those of us that are in middle to upper class have that ability. When one person does, the whole community wins. And so we want to help folks from their need to their potential, and you can be a part of that. So give us a call.
And just to kind of echo that, we say if there's a bad guy for the health clinic, it's a lack of affordable health care, which is a major issue in our community.
Yes.
And whatever whatever role you're in as a patient, sharing this with somebody else that might need the help, that might need to connect as a patient, sharing it with someone who might want to get involved, all those are helping fight fight the lack of affordable healthcare and bring affordable
Yes.
healthcare to our community, and as a larger picture, helping fight poverty and bring thriving to individuals in our community. And that's what we're about, and
It
doing
is.
that through the love of Jesus. And so that's why we do what we do. Thank you for listening. Any questions, anything, you can visit restoringpeople.com. Health clinic specific, you can do that, or you can visit evansvillechristianhealthclinic.com. Thanks.